Hello everybody, Namaste, greeting from Art of Healing Cancer. Today we want to share an interesting experience with all of you. So a 60-year-old male came to us and he had a recurrent posterior tongue cancer or an oropharyngeal cancer. So the patient had been diagnosed few years back and he had first taken neoadjuvant chemotherapy followed by transoral robotic surgery and chemoradiation. And for next few years, the patient had a decent amount of disease control. But for last 1 or 2 years, there was a mild kind of uptake which was being found in the posterior part of the tongue. But due to complete trismus and difficult exposure, the fiber optic biopsies which were performed did not yield much result. So by the time patient presented, so he had a large 5 to 6 centimeters of primary in the posterior part of the tongue, and there was no other distant metastasis. So again, we embarked upon our methodology of understanding the disease biology. So again, a circulating tumor cell analysis was done, along with tissue biopsy was performed to prove that it's a cancer. And with these tumor cells and tissue biopsy, we were able to do the tumor viability assay, transcriptome analysis, and accordingly, we were able to form a treatment approach. In the treatment approach, we again embarked upon a systemic therapy first, in which we used cytotoxic chemotherapy, 2 agents. Along with it, we were able to understand that VEGF inhibitors are better as compared to checkpoint inhibitors, because on our analysis, the tumor was not expressing the checkpoints much. So we integrated it with VEGF inhibitors, EGFR inhibitors. So these were the standard of care. And along with that, we integrated it with natural supplements, off-label medicines. And it was like, to our surprise also, the patient had a decent response. So this was the kind of a mixed integrative approach which we used, embarking upon a main pivot point of standard of care along with nutraceuticals and repurposed medicines. And then we took the patient for a radical surgery in which the posterior part of the tongue was removed along with the reconstruction was done. And when we looked into the final histopathology report, so it was like this very amazing report which we all wanted to share with you. So the residual tumor was very less, only 10% viable tumor was left behind, suggesting that the patient had a very decent disease response. The disease responded very well to the therapy. And with the radical removal of the tumor focus also, now at this point of time, we could say that the patient is in R1 status. And thereafter, we are maintaining the patient on nutraceuticals with some VEGF inhibitors, and the patient is doing well. And now, when I'm sharing with you about this patient, the patient had a disease-free survival of around more than 11 months.